On Call, I'm Jenna Miller. Physical therapy is a practice that's been used for thousands of years. It involves treatments that focus on prevention and management of injuries or disabilities. Physical therapy helps to relieve pain, promote healing, and restore function and movement. Like any other form of healthcare, there are a number of specialties that address different types of injuries and various parts of the body. Physical therapy, that's our topic today on Doctors on Call with our guest physical therapist, Troy Moore.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital, experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Troy Moore received his undergraduate bachelor's degree in kinesiology and sports medicine from Emporia State University and his master's of science in physical therapy degree from Wichita State University. He graduated with his doctorate of physical therapy from Regis University in Denver, Colorado. He is a certified strength and conditioning specialist and has practiced general and sports-related physical therapy and rehabilitation for more than 20 years in central Kansas. Troy is the director of physical therapy at Ellinwood District Hospital and provides physical therapy for Barton County Community College Sports Medicine Department. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. Thank you so much, Troy, for coming back and being on our show. We got an emailed question right away, so we're going to start off with that one. This one comes actually from a viewer in Ellinwood, and she says that her legs constantly hurt. It's hard to walk, and the pain in my heels is unbearable. She's 69, exercise only seems to make it worse. She's overweight and not as active as she once was, and is wondering, is there anything she can do at home to relieve this?
Okay, well, good question. I see it a lot, and the first thing is identifying the problem. So if this person has pain in the first thing in the morning, like that's the first painful step, then probably like plantar fasciitis, which is a common condition in your feet. There's some stretches she could do. If it's the whole leg, I'd worry more about her back, nerve, maybe even blood vessels. So the biggest thing to do is get it looked at, and then identify exactly what's wrong, what medicine she's on, if there's anything else medically going on. And then if all that's fine, then simple nerve stretches, calf stretches, some heel stretches are pretty easy to do. Unfortunately, they take a while to kind of take effect. And then in physical therapy, we could do other modalities to kind of help with her pain. But as far as home exercises, I hate to say it, but you could Google just calf stretches, and she could find simple stretches to start that don't hurt, and then go from there. And then always kind of come by and let me look at it. I think that's the key, identifying the true problem.
Okay, now you mentioned stretching a lot.
Mm-hmm.
How important? I think stretching is kind of time consuming, so people kind of want to skip the stretching and go right to the exercising. How important is stretching?
I think stretching is important for nerve problems. So the old days of holding that stretch for 30 seconds and kind of feeling that pain, we don't do that anymore. We do more nerve glides, which are all movement based, and most likely take 10 to 20 seconds, but you do them more throughout the day. So I think stretching, what we do now, is more for nerve health, blood flow, trying to get the cells in the body moving better, versus the old school hold and feel the pain for 30 seconds to a minute. Kind of haven't done that for a while.
Okay. And why does a patient need physical therapy? Why is it necessary?
Well, they say sitting is worse than smoking now. And as the world is more involved with media, phones, tablets, TVs, we simply are not moving enough. And I think that's the key to physical therapy. That's why we simply just try to get the body moving better and then teach them how to move themselves. So physical therapy in my world is more movement-based, hands-on based, to try to educate them on how to do it themselves, prolong life, prolong health, stuff like that.
And if a person goes into physical therapy, how important, they might go, I don't know, 2-3 times a week, how important is it to do the other stuff at home?
Very important. So, and we know if it's happening or not. I actually probably do less frequency now, so 1 to 2 times a week. I spend half my time on education and telling them how to do things, or maybe even what to change in their life to try to decrease their problems. But yeah, if you want to make a change, you kind of have to do this daily. And we kind of pride ourselves on not giving them a book of exercises to do, but maybe just 1 or 2 to do and get really good at. And then we can progress from there. Another thing I do is I use technology, so I have them track their steps. And I monitor if they're walking 3,004 steps, increase that or decrease. So I try to use stuff that we use on our wrists, our phones, to our advantage to try to teach them how to move and how much to move.
Sure. And how do you go about finding a licensed physical therapist?
So the American Physical Therapy Association has a great website. There's a Find a Therapist button on there. Again, just searching it, Google, we typically all have licenses which register with Google, so you could find us really easy. And then you could always ask your physician for who they like or who's around. Physical therapy, we're pretty handy to find now. There's a lot of us, even in central western Kansas. We've done a better job as a profession promoting ourselves. I think we're easier to find than we were 5-10 years ago.
And what's the difference between a physical therapist and, say, a trainer?
So a fitness trainer probably has a degree. They have certifications. They spend most of their day working on strength, conditioning, weight loss, nutrition, stuff like that. Physical therapists, we do that, plus we do modalities or we do manual therapy. So modalities may be dry needling, ultrasound, or tissue mobilization. The fitness trainer, does not allow to do that in the state of Kansas. So we're probably more medically based and they're more like fitness center based. But I work with them all the time because ultimately my job is to hand them off to them. Excellent.
And so what are some of the most common conditions that you find need physical therapy?
Sure. So most of my career I've worked with surgeons. So post-surgical rehab was a big part of my life. Now that I've moved to Ellinwood, I'm almost like the first line of defense for just general back pain, neck pain, headaches, vertigo or dizziness. So I get more of the general pains versus now than when I was working with the surgeons. So general low back pain, neck pain is very common right now, probably my most common thing, secondary to like the sports injuries that I see at the high schools and the college, which still involves the knees and ankles and shoulders.
Okay. And what takes place? Take us through the steps of what happens during an exam?
Sure. First of all, there's always paperwork, so we get that done. That paperwork is actually really important to us. It details if there's an accident or not, how long you've been dealing with this. And then we take you and we just start talking with you. I have a friend that is a professor at Duke, and he just did a research study that the average physician interrupts you within 18 seconds. It's probably because they're so busy. We have an hour usually with you. So we first of all tell you expect 45 minutes to an hour, and we talk for a while, 10, 20 minutes. You can tell your story, and I just listen. And from there I start to figure out kind of like what's most important on their list. How are we going to do this? Kind of red flags that go off, general medical exam, and then we look at the body part that you have trouble with. We examine it, we push on it, we see how it moves or it doesn't move. So we're still very hands-on, and then we pick a modality or something to help with your pain or symptoms, and then it's always followed up with some type of exercise. And usually you sent home with an exercise sheet, and we schedule you out, and we kind of really get to know you that first visit, and then really figure out what you need from there.
Is there ever any pain that's involved with physical therapy?
There is. There's conditions. I treated 2 today. One's called a frozen shoulder. Adhesive capsulitis, where the shoulder's just kind of stuck down. you have to stretch that out. And when you're stretching that, there's fibers that are pulling and tearing, and it's painful. I started a total knee last Friday, and it's big and it's swollen, but we still got to move it. So we minimize it. I tell my patients if I'm getting to a 6 out of 10 pain level, I need to know, and we probably need to stop. So I let them go a little bit and then back it off. So it's not pain and torture, but there's some discomfort sometimes.
And what kind of, what are we looking at as far as you said total knee or something like that as far as recovery? Or how long do they typically take or are in physical therapy?
So when I first started, it was a full 6 to 8 weeks. I believe now we're down to a month. We used to go 3 times a week for 6 weeks, and it would be a struggle. Surgeons, techniques, robotics, they're changing the game, which is only making the patient get better faster and makes my life a little easier because I don't have to fight so much swelling and pain. I just did a lady from Kansas City. I saw her 7 visits after her total knee, and then she is fine. She's back to the gym doing her own thing. So everybody's different, but the time is getting much, much less for a total knee.
Sure. And what about a rotator cuff surgery? We had a question about that. There's a person's surgeon advised them that they needed a lot of physical therapy. How long does rehab take after that surgery?
So different, okay? So rotator cuff is a tendon. So tendons are white, which means they don't have a lot of blood flow. So anything like that's going to take a longer amount of time. Typically that surgeon will hold them in a sling for a month, no movement, and then they can expect up to 3 months with me. And it's a slow protocol. We can only do certain things at certain times. So depending on the tissue that they had repaired, like a rotator cuff tendon, it takes a while still. That hasn't changed much at all.
Sure. Now you had mentioned earlier in the show dry needling. We've also talked about that with a couple of our chiropractors this season. Let's have your take on what dry needling is and what's the difference between that and acupuncture.
So dry needling has changed my practice a lot. I was slower to get certified, but now I kind of regret not doing it faster. But it is acupuncture, dry needle. It's the same needle. We're buying the same needles. We're using the same needles. It's just the way our philosophy is behind them. Acupuncture, from what I have been told and researched, is more about the yin and the yang, Chinese medicine, kind of old, thousands of years histories of body chemistries and how things flow. Dry needling is definitely muscle and nerve. So for every level in your back, that nerve controls something in your arm or your leg. We're trying to tie all that together. So when I place a needle in somebody, it's into a muscle only. And that muscle ties to a nerve, and I'm trying to get something to either feel better, work better, something to calm down. So I use it every day on people, and it's working really great. But that's the difference is dry needling is more muscle, nerve based, and acupuncture would maybe be more body system, kind of some older theories.
Sure. Does physical therapy require a doctor's referral?
No. So since 2012, 13, we got direct access in Kansas. So a person off the street can come in and see a physical therapist for an evaluation. And then under Kansas law, that person needs to show progress within 2 weeks, or we need to refer to a physician. So don't necessarily need a referral, but we're really on top of that. If they're not getting better, we're going to refer them to their doctor. And then some insurances require it, so we check all that first. But in general, we're direct access, and it works really, really well.
And can you do physical therapy out of a person's home, or is it all out of the hospital?
Believe it or not, there's therapists that are kind of reinventing the wheel, and they're traveling to work sites, or they may go to your house, and that's outpatient, so they may be cash based. They might not go through your insurance, but that's getting bigger. There is home health physical therapy for people that can't get to the hospital. That goes well. But the most general, it's a clinic or a hospital. I mean, the majority of the time, that's where we're at. Telehealth during COVID took off. I can't say I use that a lot, but it is possible for people to do physical therapy via telehealth. So I have done it, and it worked okay. Okay,
great. We want to remind our viewers that we are talking about physical therapy tonight on Doctors on Call with Troy Moore. Give us a call at 800-337-4788, toll free if you have a question. Let's talk about I was talking about our chiropractors have been on earlier this season. How does physical therapy differ from chiropractic care?
Good question. I think chiropractic, notoriously, they're known for back pain. So back pain, they have their own techniques. They do thrust manipulations. So do physical therapists, but they have their methods. But typically, you go to them for back pain. Physical therapists, we do back pain. We go head to toe. And I'm sure some chiropractors do that too. But we're similar. And we refer back and forth, or at least I do. But notoriously, they're seeing back pain most of their day. That may only consume about 30% of my day. So they typically don't see you after surgery, so they don't do your rehab. They can do x-rays, I cannot. So I use our chiropractors in the area. They may take x-rays to determine if something's good or bad or needs referred on. So they're typically back, and I'm kind of a mixture of everything.
Sure. Do you use ultrasound?
I do. It's been around a long time, and I've been around a long time doing it, so I still see patients getting benefits from it. Whether it's just the heat that it applies, or if it's the 10 minutes of me rubbing a warm thing on their back. Maybe it's just the hands-on approach, but yes, I still use it, and I still think it's beneficial.
Sure. And what about e-stim? You might talk about what it is and if you use that in your practice.
So electrical stimulation is a way to block pain. You can also increase blood flow with it, but in the past we have used pads to go to a machine, commonly like a TINS unit. There's interferential stimulation, and then there's TINS units, and the machines we use in PT are typically about 10 times stronger than that home TINS unit. We put pads on them, and that applies, and you do it for 15 to 20 minutes. I do electrical stimulation through the dry needling now. So instead of putting the pads on you and making it kind of a passive treatment, I'm putting the needle on, they have little alligator clips, and then I apply electricity through that. And I found that to be probably the most effective, because some of these tissues I'm in are, 4 or 5 inches deep. Well, that TINS unit or that pad is not going to penetrate that far down. So I'm most successful using the needle with electricity.
Sure. And how do you differentiate which patient needs e-stim treatment and which don't?
Sure. So a lot of it, medical history. If they have a pacemaker, if they have current cancer, if they have an open wound, they're not a candidate. If it's a little area of pain, I might go ultrasound. If it's a big area, I might go e-stim. Also, previous successes. So I have some patients coming back and say, hey, you did ultrasound to me 3 years ago. It really helped. Well, I'm probably going to do it again, and because they know it worked, and that just helps. So based on their medical history, based on kind of the area I'm working on, how deep is that area, then I decide which one I want to use.
Okay, excellent. Well, we are going to go to the phone lines. We've got Lynn on the line from Great Bend. Go ahead, Lynn, with your question for our physical therapist tonight. Hello, Lynn, are you there? Okay, well, we lost Lynn. So, Lynn, if you want to ask your question, you can go ahead and give us a call back. We've got a little bit of time left on the show to do that. Diane is on the line. Go ahead with your question, Diane.
Yes, I took a fall about 4 years ago, and after I've had X-ray, I've had MRI, I have had a CAT scan. They said nothing was broke, but the last X-ray I had shows some bone on bone. And I am wondering if physical therapy, if there's anything that can be done other than surgery to help that pain.
Sure. Diane, was it your hip or knee?
I think sure.
It's not my hip. It's a lower back.
Lower back.
Yeah, the lower back.
Okay. So bone on bone means your cartilage has worn off. So think of that as the tread on your tires. You start with a good tire, and then the tread slowly wears away. The bone has cartilage on it that wears away too. So when we say bone on bone, it means your cartilage is gone, which means you have less space. The low back is an interesting spot to have that. It's basically arthritis, and you can use physical therapy techniques So typically you wouldn't respond to what we call extension exercises. You'd be more flexion. So specific stretches would definitely help you. Other exercises may actually hurt you, so you got to be careful on what you're going to do. Dry needling can help with inflammation. Ultrasound can help with inflammation. But basically, Diane, if you can control the inflammation in your back, you will control your pain. So another possibility would be an epidural injection. And you could call, they're in Great Bend, they do them there. They do a good job, but an epidural would control the inflammation in her low back, and then that may help her as well. So.
Okay, great information.
Cool.
Okay, we're going to go back to the phone lines. We've got another Lynn on the line. This is Lynn from Luray. Go ahead with your question for our physical therapist.
You can use physical therapy techniques. So you respond.
Go ahead, Lynn, with your question.
So specific stretches would definitely help.
You're having troubles with the second Lynn. Okay, go ahead and call back. If we, like I say, we got just a couple minutes left of the show. So you had mentioned arthritis. Do you treat a lot of patients with arthritis?
Almost 80% of everything I do is based on arthritis. So that could be arthritis at a young age, arthritis at an older age, but basically our bones, our cartilage is wearing down at a fast rate. And I don't know if it's from the food we eat, the stuff we drink, I don't know. But it is a very, very large portion of what our job is. And the biggest point about arthritis is we got to move it. I have a therapist, John, in my hospital. He says, motion is lotion, which means if it doesn't move, it's not going to get any better. So I know it's scary to say arthritis, but movement is the best option on that.
Okay. Okay, I believe we have a phone call from Meredith waiting to ask a question. Go ahead, Meredith, with your question for Troy Moore.
So I know that there are a lot of athletes out there who experience injuries playing sports, things of that nature. And I was just curious, how do we, or can we, get with you as soon as possible when our athlete is injured, and how does that impact their performance going forward?
Good question. So obviously call right away. So if you can treat that injury within 48 hours, we're going to stop inflammation faster. So calling directly to the therapist is the first step. If you have an athletic trainer at the school, work with them to get to me, because we work together all the time. But if I can get that patient seen faster, treated faster, I have a better chance of getting them back on the field or court faster. As we delay treatments, as we delay x-rays, delay everything, we're losing time. And I know it's important to get those kids back on the court. So calling the PT directly, using direct access in Kansas, I think is the most important part.
Okay. We have just a few seconds left and a caller wanting to ask a question. So let's get this in quick before we wrap up the show. Hi, Lynn. Go ahead with your question.
I have a question how he treats tennis elbow.
Tennis elbow. So tennis elbow is treated two ways. I can use tools on you to kind of scrape the skin to recreate the inflammation process. I know that sounds bad, but we got to that's also the first stage of healing. So I use techniques to get the inflammatory cells re-going again or calm down. Dry needling would be another. I put them in the muscles of the elbow, run electricity through it. Also, if that doesn't work, then PRP injection from the surgeon works really well too. So the old school, there's lots of methods in PT to treat tennis elbow, and but the most successful I've had is through the dry needling or some type of modality to calm it down. And
speaking of which, how often are you able to see a client and actually be able to prevent surgery?
Oh, that's tough. I'd like
or
to say a lot.
Or is it possible, I guess?
It's possible.
Sure.
So part of my job is to try to keep them out of the OR, particularly back, spine patients. That's a rough process. I think I'm successful. I don't know how much, but the other problem is sometimes these joints are just done. Like, I can't put more tread on the tire. But I know now with surgical techniques, they are going to be better afterwards. So I really, really try hard to keep them out of the surgical OR for the back patients, because I don't think we're quite perfected that yet. But as far as like knee, shoulder, hip, elbow, ankle, I think they do really well. So I'm successful sometimes, but I also think my work before surgery helps them after.
Excellent. Okay, great advice. Thank you so much for coming back and being our guest on Doctors on Call. Our next Doctors on Call will be discussing dementia and long-term care. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from CAMCO, the state's only Kansas-based medical liability provider, serving medical professionals and advocating for the health for all Kansans.
Russell Regional Hospital. Experts, neighbors, friends.
Your family is our family. Staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in North Central Kansas.